Hi, this is Catherine Bakewell reporting to you for Room Now. I'm in Washington, D.C. for ACR 2024, and I wanted to tell you about the best thing that I saw today, which was related to sex differences in psoriatic arthritis. We started off the day with session 17S08. It was a combined session by Laura Coates and Lihi Eder, and we learned that females have a significantly different baseline characteristic profile as well as response to therapy. So females by and large are going to report more pain and disability. They're going to have higher overall composite disease activity scores. They're going to have lower drug persistence, aka discontinue drug more often, and more adverse events related to medication, which again you would assume is a correlate to that as well. Whereas males are going to have higher CRP levels, higher levels of dactylitis, PASI scores, aka worse skin psoriasis, and more radiographic progression, but the good news for them is that they tend to have better treatment response. Interestingly, they also highlighted some data around ultrasound that, of course, I, as a lover of ultrasound, found particularly fascinating, which was that men tend to have higher ultrasound enthesitis scores, both by grayscale and color power Doppler, whereas women tended to have higher clinical enthesitis scores. And to me, this underscores not only the importance of objective measurement, aka with the ultrasound showing us true inflammation, but we need to better understand why is it that our females in general have more pain reporting, more pain in general. These are probably a gender-related difference in our gender expectations around the stoic man not reporting his pain, whereas it would be more okay for the woman to talk about her discomfort. But also we know that hormones significantly impact immune function and pain processing itself. So Dr. Eder showed us a slide showing us that microglia in the level of the spinal cord in men regulate pain signaling, whereas in women it tends to be more T-cell regulated. Dr. Eder also showed us a meta-analysis of 54 different randomized controlled clinical trials looking at ACR responses in psoriatic arthritis and specifically looking at ACR 20 responses. Only 9 of the 54 RCTs reported sex disaggregated data, aka showing us how men responded differently to women. But when analyzed, it did appear that there was a tendency for the men to respond better to biologic therapy. All of them examined TNF inhibitors, IL-12/23, IL-23 inhibitors, IL-17s, whereas there was less of a gender discrepancy for the targeted small molecules of JAKs and TYK2s. One possible mechanism for this, she also showed us a study that demonstrated that women have higher immunogenicity to at least infliximab, so maybe there is an issue there. But regardless, we need more data. 9 out of 54 is not good. She shows us how they don't separate women based upon whether you're 20, whether you're 80. It's all lumped into one pile, and again, a minority of these trials differentiated by men versus women at all. Last abstract I want to highlight for you, this is 1709, entitled Sex Differences in Serum Proteomic Profiles of Males and Females with Psoriatic Arthritis. This was presented by Stephen Dang, and it did demonstrate that men had an over 20-fold increased level of protein deregulation relative to females. That, unfortunately, they did not measure estrogen and testosterone levels, but they did break down the women into premenopausal and postmenopausal status. So there is some hope that we're gathering more hormone-related data, but we do need to be studying our females more closely, both for hormone levels throughout the menstrual cycle, but also pregnancy, nursing-related, and of course pre- or postmenopausal status. We also need to be gathering data around gender and the impact that that can have on response to therapy in psoriatic arthritis. So a call out to those in industry to please join us in this fight. I will mention Dr. Eder one last time that she is running the SAGE trial examining sex and gender related differences in PSA response. And that's all I have for you today. Thank you.